Miley.
Okay, first of all, I'd like to thank the committee for allowing me to speak. I feel especially humble and very nervous, so please forgive me. Speaking after so many amazing speakers. Okay, first, a quick history about me, because obviously I'm important. I have worked as a radiographer and sonographer, which are just fancy words for X-ray taker and ultrasound wand holder. And I've done that for too many years to count. I've taught at universities both in Australia and in the UK. So I could stand up here and talk about the many patients I have seen who've been treated by chiropractors, both good, because we all know someone who's been helped by a chiropractor, and the bad. You know, such as the 8-year-old girl who presented to emergency with severe back pain. Her mum had been taking her to the chiro every week to treat the pain, but after 7 months, things had gotten so severe with the pain and she felt so sick that the mum brought her into the hospital. By the time I met them, she had just been diagnosed with a kidney infection and the function in one of her kidneys was down to 20%. 8 years. The chiro never once in that time suggested to the mum to take her daughter to a GP for a checkup. I could talk about that kind of stuff, but I won't. Instead, this talk focuses mostly on the imaging side of chiropractics and their training. I've split it up into a quick X-rays and radiation section, just in case you need some basics. And then I plan to scratch the surface of some of the training differences between radiographers and chiropractors. Why, I hear you ask? Did you know in Australia, chiropractors are trained and authorised to request and take their own X-rays? And that they can go on to assess their own X-rays for abnormalities prior to commencing treatment. Why perform an X-ray? So, just a bit of background. I know it can get a little bit confusing, and it probably is a bit confusing, but for the purposes of imaging, we tend to use the terms radiograph, image, and X-ray interchangeably. However, it's not entirely accurate. X-rays are the electromagnetic waves used to take or to make the radiograph or image, not the actual image itself. As technologies change, it is interesting to note that X-ray imaging of non-specific back pain is no longer the gold standard. Rather, MRI is preferred. However, why do radiographers take an X-ray? They do it to perform an assessment of bone structure, alignment, and abnormality, and to give doctors a confirmation of diagnosis or pathology at the request of other people. Chiropractors use X-rays to determine appropriateness of care, to identify contraindications to treatment, and to assess for spinal subluxations, according to the Chiropractic Board of Australia. So, I can tell that you're all sitting there asking, what are these spinal subluxations? Okay, medical definition of a subluxation. It's a partial or abnormal separation of the articular surfaces of a joint. So we usually see it in the spine, in the anterior cervical spine, fancy word for the front of the neck. And it's usually due to trauma. Okay, so in this picture here, you can see that there's a little tear in this ligament that holds these two back bits of the bony vertebra together. Okay, and it's from a hyperflexion injury, meaning like a whiplash. So the patient's head is flicked forward quickly. Okay, and that has allowed this top vertebra to slip forward a little bit on the bottom vertebra. So here, if we look at an X-ray and we follow the line of these vertebrae up, we see here there's a little step between the end of this one and the front of this one. This is what medical terms is a subluxation. When we have that little slip, it can cause compression of the spinal nerves as they come out of the bony vertebra and cause pain. Chiropractic definition. I have to read this one from the slide. It's an alteration of the biomechanical and physiological dynamics of contiguous structures which can cause neural disturbances. Whew, there's a lot of big words in there. All right, so I took this picture here from a chiropractic resource, taken from the Chiropractic Resource Organisation. We can see in this diagram, you have these edges of the spine meeting up, these edges of the spine meeting up, and these edges of the spine, or each vertebra, running parallel to each other. In the one next to it, which they term as lateral malposition, you can see that the edges, whilst these edges of the spine run contiguously, these edges here are splayed slightly. Now, I can tell you that if I get a patient to lie or stand in just the right position, I can make my x-ray look like that in a normal person with no back pain. So how can they say it's a subluxation? Okay. So let's have a look at radiation. What is radiation? It's the emission of energy as electromagnetic waves or as moving subatomic particles, especially high energy particles which cause ionization. We have our little picture here. I'm big on pictures if you hadn't realised. So we have our radio waves. The wavelength is quite far apart, and as we move along to our microwaves, our light, our X-rays, and our cosmic rays, we can see that the wavelengths shorten. As the wavelengths get shorter, the energy of the particles or wave increases, in turn increasing the likelihood of ionization. And for the purpose of my talk, ionization is bad. Two types of radiation: non-ionizing, our microwaves and our radio waves, and ionizing. So our alpha particles, which are basically protons, sorry for the physicists in the room, beta particles, which are electrons, gamma rays, or our cosmic rays, and X-rays. If we look at this picture, we can see in general, because I listened to Lawrence's talk the other day about electrons, so I know this isn't real, our alpha waves, or our protons, are stopped by a piece of paper. They hit the paper and they can't go any further. Our beta waves hit skin and can't go any further, so they're our electrons. Our gamma rays can go through everything, but can only go through a certain percentage of lead before they get stopped. X-rays can go through skin, bone, wood, but the lead kills them, okay? And our neutrons, which just go through everything. Okay. Please note that I am not a physicist, so this is my simplified version of how radiation works. So just to make things extra tricky, every article or dose reference chart you will ever read is in different units. They use grays, they use sieverts, they use rem, and they use Rontgen. And I apologise to Professor Ernst for brutalising the term Rontgen. I know that's not how you say it. But, and they all have different factors. So we can see down the bottom that 1 milligray is the equivalent of 1 millisievert, which is the equivalent of 115 milli Rontgen and 100 milli rem. So just in case you didn't know, Rontgen's the guy who produced and detected X-rays in 1895, and for this he won a Nobel Prize in Physics. Okay. ARPANSA is the Australian Radiation Protection and Nuclear Safety Agency, and they set dose limits. So, a dose limit is a limit of radiation exposure per year averaged over 5 years, but that doesn't include background dose. Okay? So, as a radiographer, I'm allowed to get 20 millisieverts per year, or 2,000 millirem. As a member of the public, over a 5-year period, you should only get 1 millisievert per year, okay? And the average background dose is 1.5 millisieverts, okay? So over and above that 1.5 millisieverts, you should only be getting around 1 millisievert per year. Some dose examples. With X-rays, a chest X-ray is about 10 millirem, an abdomen about 60 millirem, a hand x-ray about half. A CT is a computer tomography picture of a chest. You get about 700 millirem, and for the head you get 200 millirem. As a radiographer, we probably dumb it down a little bit more. And if you're having a chest, abdomen and pelvis CT scan, we say that it takes a year off your life. Okay? That's just a generalization. Okay, so let's put this into perspective, because radiation is everywhere. Smoking 1.5 packs a day gives you up to 16,000 millirem of radiation per year. Flying for 5 hours is approximately 3 millirem. And that radiation is from the cosmic radiation. Eating 100 grams of Brazil nuts is approximately 1 millirem. What, I hear you ask? Brazil nuts? Okay, so Brazil nuts grow with deep roots which absorb the naturally occurring radium, especially the ones that come directly from Brazil. And bananas, who'd have thought it? Eating one banana gives you about 0.01 of a millirem because they absorb the natural radioactive potassium-40 from the soil. So the National Radiological Protection Board of the UK has published a list of average entrance skin dose charts. So the entrance skin dose, as the name suggests, is the amount of radiation dose absorbed by the skin entry point. So we can see here an example dose for spinal x-rays in a 70-kilo patient. It's broken down into the different positions that radiographs are taken in. So AP means from the front to the back. LAT means lateral or side view. So for example, imaging of the thoracic, the torso, and the lumbar spine, so the abdominal part of the spine, alone with 5 views is about 6,000 millirem, or the equivalent of 30 days background dose. Now, radiographers work under the ALARA principle. We all know that we should be looking at the risk-benefit ratio. Basically, ALARA, which stands for as low as reasonably achievable, means that the benefits of the information that imaging will provide needs to outweigh the risks of the radiation dose absorbed by the patient. In the UK and Europe, they work with IRMA guidelines, under which the radiographer is responsible for justifying and authorising each radiograph, ensuring that every time they use the X-ray machine, it must be necessary. Okay, so we've finished all the hard physics bits, and I put this up just because I love this picture. So this is a pelvis down here. We've got a spine up the middle, some ribs, and there's this weird white mass in the middle. Okay. So just to put it out there, this is a lady with a cutlery swallowing fetish who swallowed 78 forks and spoons. Okay, but I needed to break it up. We've done the hard bit. Okay. So let's talk about basic training. Chiropractors receive training in radiology and radiography as part of their chiropractic education, and that is taken directly from the Chiropractic Board of Australia website. What do they do in terms of their training? In terms of, their work. Radiographers assess the request from the medical professional, limit the imaging to the area required, and work under the ALARA principle. Chiropractors conduct physical examinations, adjust and manipulate body joints and soft tissue, give advice about general health matters such as nutrition and exercise, and they have the ability to take and interpret diagnostic images. So the basic training. Radiographers. Well, I went to radiography school. I studied for 3 years with theory and practical sessions every week. I did the universities in Australia do an average of 32 weeks over a 3-year period on the job, so working in a hospital. And then at the end, you have to do 1 year on the job to be fully qualified under the program that I went through. One of the universities that I know better than others here in Australia, they do 1 to 2 subjects of imaging training over the course, over the entirety of their course. And practically, they do about 2 hours a week for between 10 and 20 weeks. So at the beginning, the students start with common core subjects, such as anatomy and physiology, and the chiros then go on to focus on meridians and subluxations. Excuse me. At the end of their training, the radiographer can take the radiograph. That's it. That's all you can do. The chiropractor, on the other hand, can request before, excuse me. Thank you. Request, perform, and read the image. Oh dear. So, sorry. Thank God. Let's see. So, radiographers. If you're looking at the neck, you take between 3 and 5 images. If you're looking at the thoracic spine, the bit in the middle, 2 images. Lumbar spine, we do between 2 and 5. And we often look at the whole spine, which is 2 images. Excuse me, I'm so sorry. But the number of images we take depends on the clinical information we require. We just don't go willy-nilly taking whatever. We only re-image if there are changes in symptoms or once every year. And the dose depends on the area that is imaged. Chiropractors will take 5 to 7 pictures of the neck, up to 4 images of the thoracic spine, 5 to 7 images of the lumbar spine, and 2 to 4 images of the whole spine. They'll take bending pictures, moving from side to side. They'll take pictures with you bending forwards and backwards. They are known to re-image every 3 to 6 months that you visit them. One spine is a dose equivalent of 6 to 12 months background radiation. The suggested fee by Medicare for a full spine x-ray is $110, according to 2014 prices, with a rebate of $82.50. However, the actual amount paid by the patient is only a suggestion. They can charge whatever the practitioner wants. Radiographers have to do continual professional development every year to maintain their radiation license. And they have to perform constant quality assurance within the practice. We used to have a box full of all the bad x-rays you chucked out. Somebody would go through it and check them all. With your name on it, they would come and talk to you if you did the wrong thing all the time. And you also have radiologists who monitor your work quality. Thank you. Chiropractors self-assess their images. And whilst they have to do continuing professional development, it covers the whole of chiropractics, not just imaging. The difference. Radiographers do take x-rays, however, this is at the request of a medical professional and is interpreted by the qualified radiologist, who, by the way, undergoes 4 to 6 years of medical training, 1 year as an intern, 1 year as a resident, an average of 5 years as a radiology registrar, and then 1 to 4 years as a fellow before being considered fully qualified to diagnose and report radiographs. Okay? So that's a minimum of 12 years, and all they do is read it. Chiropractors refer their own clients for imaging, take their own images, and interpret them. Yeah, they've all got heels on, they've all got their perfect posture. But I want you to have a look at the x-rays next to them. Yeah, they are terrible. Okay. The 2 images on the left are from chiropractic websites as examples of good images. Yeah. The image on the right is from a diagnostic imaging centre. Can you see the difference? Okay. Here's what I see when I look at it, apart from being rubbish x-rays. We have a head. We have a full pelvis. In terms of radiation-sensitive tissue, the breast, the thyroid, the orbits, and the gonads. Our only hope is that as technology increases, the prices of imaging equipment also increases, and that will put the chiropractors out of the price benefit of doing their own x-rays, and they'll be more likely to send their patients to diagnostic centres so that the radiographers can do them for them. Thank you very much, and I'm so sorry.